And it's recording. You're good.
Thanks. Hi, everyone. Michelle Grimolia here, the CEO at Woodland Pond. Today is Monday, November 16th, 2020, and I wanted to provide all of you an update as to some recent reports of COVID in staff members on campus, which we announced last week, talk about some of the related changes that have happened, talk about some changes that will be happening as we go forward. I'd like to also cover certain Thanksgiving protocols and offer, as always, to be available to anyone following this broadcast for any questions that you may have. Before continuing, I just wanted to inform you that all of the information that I cover in today's broadcast will be issued in a memo form following the broadcast, and the broadcast will also be available for re-airing on our YouTube channel probably by 3 p.m. today. So last week I announced that towards the end of the week we had an independent living staff member test positive for COVID during part of our routine weekly testing. The staff member was remains completely asymptomatic and was just as surprised by the diagnosis as we were, which came, as I said, from the standard weekly testing. That staff member had only worked one shift in the preceding 14 days and just drove a single resident. He's a driver. The resident has quarantined and was tested for COVID today. The resident remains completely asymptomatic. Again, this is an independent living staff member and an independent living resident. So that was issue number one. As the week continued on, we received a report on Friday that one of our staff members in assisted living, who works in the dietary department, tested positive during her routine weekly COVID testing. Again, this came as a significant surprise. This staff member is completely asymptomatic. She has not had any contact with anyone known or suspected to have COVID, and she remains asymptomatic through this broadcast. That staff member, although completely assigned to assisted living for her work, as you know, we're really trying as best we can to segregate the staff, worked in close contact with, or works in very close contact with, the significant other of an independent living staff member. So many of you have asked, why should independent living be impacted? How is there moderate risk to independent living, which is the way that I announced it last week. There's moderate risk to independent living. It's because we do have circumstances, and there are a number of them on campus, where staff members may be assigned to one unit or the other and truly be sticking to that, but they reside with another staff member that works in a different area of the community. So we've responded to that. We have spent the weekend identifying all of the circumstances where we have cohabitants. We have asked staff to self-report if they are in an intimate relationship, whether it be friendly or romantic, and spending time with folks on campus, off campus, that are from different areas of the community, because what we're going to try and do as much as possible is take those duos or trios of people and make sure that they are assigned to the same part of the community. So that this way, if there is a situation where there is a single person in the health center, for example, that tests positive, which we fully anticipate will happen again, that we can ensure even less crossover. So as we go through COVID, we're constantly tweaking and strengthening the knots of protection. And so this is something that we're working on. We have made some immediate changes over the weekend. We've got a couple more in the works. And again, we have no concern at all that there has been any spread. None of this dietary staff members' coworkers have reported any symptoms of illness. All of the staff have been retested, and those test results are coming in as we speak. all of the health center residents have been tested since this weekend, over the course of the weekend and through the weekend, to ensure that there has not been any spread of this asymptomatic but present virus in this dietary staff member. On Saturday, a staff member that had tested positive in October and was one of the 3 staff members in the health center that had truly been ill. He had spent the required period of time out of work in accordance with the New York State Department of Health and CDC guidelines. He had tested negative twice and returned to work last week. And in his routine weekly test last week, he tested positive, and we were informed of that on Saturday. So again, this is an area in his role. He works in the rehab department, does not do direct resident care at this time because of the scare that happened in October. But there is moderate, risk to independent living residents because independent living residents are an outpatient program for rehab. Now, in this case, and this is different than the last time, the rehab team was not furloughed this time around. The staff member himself remains asymptomatic or post-COVID symptomatic. He will tell you that he isn't sure he'll ever be back to his normal self, which a lot of people for COVID are saying. But this just goes to show that this virus is very tricky. So, as I said, he had met all of the criteria to return to work. His return to work was approved under the New York State epidemiological guidelines for COVID. He had tested negative twice after the 14-day period had elapsed, had returned to work, and then tested positive. So in speaking with the State Department of Health this weekend, we actually learned that this is very common. A number of folks that have tested positive for COVID and then recovered, tested negative, eventually test positive again. So this is the case that we're in, and that's a confusing component of this virus, as are most components of this virus. So we made the decision to temporarily halt public activity in independent living. The classes, the pub was closed, the fitness center was closed, et cetera, with very limited exception until this Wednesday. That's a period of time that gives us comfort based on the moderate level of risk to independent living. We feel comfortable resuming certain activities this Wednesday. Now, that assumes nothing changes between now and Wednesday morning. Again, we're waiting for a whole slew of return staff and resident tests to come back, and we can only tell you the plans as of today, the best plans that we can make. For the health center, unfortunately, because we did have, a new outbreak, or they call it an outbreak, but a new test positive in a staff member in the health center, which was the dietary aide, that resets the clock on visitation. So the positive news is that the health center is not placed on full quarantine at this time. We are not on droplet precautions as we had been when we had the positive residents, but in accordance with the New York State Department of Health visitation guidelines for assisted living and skilled nursing facilities, we are now on pause again for visitation, and that clock has been reset. This will continue to happen, unfortunately, anytime we get a new positive case in a resident or a staff member in the health center. There is no wiggle room at the state level. So at this point in time, based on the testing dates and the reporting dates, the earliest we could be looking at visitation in the health center again is December 1st. So please, if you are a health center resident or a health center family member, loved one, please contact our staff. You can reach out to anyone that you have email contacts for, myself included, or you can call our reception desk at 845-256-5910. Again, that's 845-256-5910, and they can provide you information on scheduling a virtual visit with your loved one, and we really strongly encourage you to do so. because it's the best way for you to connect with your loved ones now as we're on visitation hold. So for independent living, we are looking to resume the planned activities as of this Wednesday, and I will briefly summarize those. They were in a memo that I issued on November 9th. I will just summarize those in a few moments, but before I do that, I do want to talk about Thanksgiving for independent living residents. There have been a number of continuing questions about the options for Thanksgiving and what is required. So I will just spend a moment to reiterate that now. So as of about an hour ago, Ronnie had confirmed, and her staff had confirmed, the Thanksgiving plans for all but 19 independent living residents or combination of residents. So we out of the 193 occupied residences, we had independent Thanksgiving plans in hand for 19, all but 19. So that's great, and I very much appreciate everyone being responsive on that. It's very important that we know exactly what everyone is doing so that we can make sure that the Thanksgiving plans are happening in as safe a way as possible. So we are offering a number of options, and just to reiterate that, you may order a Thanksgiving meal and have it delivered to your apartment for you to dine just yourself, or you and your significant other. That's sort of the normal process of delivery. You can order it that way. You can make a reservation to dine in the dining room with residents only, so your neighbors. We are offering 4 seatings. Currently, Ronnie said we have the 2 p.m. and the 4 p.m. seatings are both fully booked. The seating at noontime on Thanksgiving still can accommodate 15 more residents. So if you haven't made your Thanksgiving plans or you're thinking of changing those, we can take 15 more in the dining room for noon. And for 6 p.m. on Thanksgiving, we have about 5 more slots available. So you certainly can call if you're a single person or if you have a group of people. We will get you seated at any of those remaining seatings. So that's the second option. The third option is residents are permitted to go off campus for Thanksgiving. We do have a requirement that if you go off campus for Thanksgiving for any period of time, because a meal is going to be consumed and because most likely you will be riding in a personal vehicle with someone other than a member of your household, those are dining inside with folks that you haven't been around and or being in the car are both considered to be high risk activities for COVID. Anyone going off campus for any period of time for the Thanksgiving meal or an extended visit, you say a number of days or what have you, all residents will be required to quarantine for at least 72 hours upon return and then have a negative COVID test before coming off quarantine. If you are going off campus, and we will have those details from Ronnie, or you may have self-reported it to Mary Jo or concierge, we will assist you with knowing when you need to have your COVID test and how that can be done. The ideal is that if you are traveling, the ideal would be that you return to campus on Thursday night or Friday morning first thing, because we already have First Care coming in to do COVID tests on Monday mornings. We could add you to the list. That way you don't need to leave campus, further exposing others. So if you are planning on going off campus for Thanksgiving, either for a meal or for a visit, and you have the flexibility of moving your schedule around, the ideal would be that you are back on campus and start your quarantine by the end of the day Thursday or first thing Friday morning, so that we could have you tested Monday. But we can make arrangements for you. The bottom line is, if you are leaving campus for the Thanksgiving meal or visit with your loved ones, we need to know. So you can do that by either contacting Ronnie or her staff when confirming your Thanksgiving plans, or contacting Mary Jo or the concierge. Either way, we're going to be communicating with everyone in every category to make sure that we're exactly set on what everyone's plans are. We're a week and a few days out from Thanksgiving, and it's very important that we know what everyone's plans are. If your plans change, or if you decide that the risk of going off campus and being around folks that you haven't been around in months is too great, just let us know, and we will be able to deliver a meal to you. We obviously welcome you staying on campus. It's the safest option for sure, and we'll do anything we can to accommodate you. So if you were planning on going off campus and you change your mind, just let us know, about 24 hours or more ahead of time so that we can accommodate your change in plans. The last option that we're offering for Thanksgiving this year, and this is limited to 40 off-campus visitors across the course of the day, is we are permitting residents to have their family members come spend Thanksgiving with them here in their private residences. So you may have your loved ones come and spend Thanksgiving with you. They can either bring their own food, or we can provide the meal for you. Again, that will just need to be coordinated with Ronnie and her staff. But the most important thing is that those visits have to be coordinated through the concierge desk. There are very, very specific guidelines as to who may come on campus, how many may come on campus, and what the requirements are. We have a safety tip sheet for those visitors, and we will distribute that to anyone that we know is having one of those indoor visits. But it's incredibly crucial that we know exactly who's coming on campus. We are limiting it, as I said, to 40 people. We are probably going to be looking for people to stagger their arrival times, so we really need to carefully coordinate this. So if you are planning on having non-Woodland Pond visitors on campus for Thanksgiving, we need to know really today, as soon as possible. Now, there has been a change, and this is very important. I'd like to cover this extensively right now, and this will all be in my memo to follow. Sorry, somebody's calling me. We have, in light of the significant uptick in COVID cases in the Hudson Valley and in the country, and that combined with the new staff test positives that we've seen, we have collectively decided that in addition to your guest needing a negative COVID test before arriving, any resident hosting Thanksgiving in their home, whether it be for an outside visitor, or if you are hosting a Woodland Pond resident, or if you are a resident attending another resident's Thanksgiving on campus, you will need to quarantine for at least 72 hours and then have a COVID test. So I want to reiterate this. This is new as of today, and it's just absolutely necessary based on the environment that we're seeing in order to protect this community. If you are hosting Thanksgiving in your Woodland Pond home for anyone other than your significant other, you will now need to quarantine for 72 hours following the departure of those guests and then be tested. So again, the ideal situation would be you host the Thanksgiving, the attendees, whether they be residents or non-residents, depart. You go into full quarantine until Monday morning, at which point we will have First Care test you for COVID. With a negative COVID test, you will be able to be released from that quarantine. This is just, it's unavoidable at this point. We are going to be having folks coming on campus. Yes, they will have a negative COVID test within 7 days prior, but you can develop COVID within 7 days. We do not want to cancel these visits. We know how important these are for all of you. So essentially now the rules will be the same whether you go off campus and dine out with a non-resident for Thanksgiving or whether you host somebody in your Woodland Pond home for Thanksgiving. All of that activity will require quarantining after the holiday for at least 72 hours, with the ideal being that you're ready to be tested on Monday morning at 8 o'clock. So I will be available for questions on this. I'm going to include this in a written memo. It's drafted on my desk right now. I'm going to look at it after we're done with this broadcast, make sure the language is clear. I will also be updating the Woodland Pond Indoor Visiting Safety Tip Sheet, because this requirement is going into effect not just for Thanksgiving, but it's going into effect for all indoor visits with outside non-Woodland Pond residents. And as well, if you are a resident that visits with another resident and you dine at all, this will apply. So the best thing to do is, if you are having a resident-to-resident visit, please do not eat or drink or take off your mask. That will allow you to avoid this 72-hour plus quarantine. If you are engaging with a non-resident in your home or off campus for a meal or in a vehicle or for an indoor visit for more than 15 minutes, this quarantine will apply. It's very simple. It's 72 hours, and then we will get you a COVID test. Some of those COVID tests will be on campus if they're on a Monday morning, and others will be off campus. But the most critical thing, we will help you navigate this entire process, but we have to know about the visits. That's the only way we're going to be able to help you to navigate this. But it's just, this is unavoidable right now. I understand from a number of sources that the governor is actively considering putting, if not all of New York State, certainly our region, back to one of the prior phases of quarantine. I don't know which phase, and I don't know the timing on that, but the numbers are rising much more rapidly than anybody would like to see. So I understand that the 72-hour quarantine may seem like a long time, but it can very well be the difference between us needing to close campus down and not, because of a potential transmission of this virus. So I will be outlining more details on that in my memo, but I do encourage you to contact me with any questions at all. I'm available a number of ways every day. I just need you to contact me. I want to just take a minute to talk for a moment about how this virus gets transmitted in terms of whether or not someone has done something wrong by contracting COVID. There has been a great amount of frustration expressed to me over the weekend about the decision to pause group and public activity on campus following the 2 new cases and the 1 renewed case over the week, at the end of the week last week. And some have gone as far as to say, you know, have the wrongdoers been punished? Meaning, have the staff members that contracted COVID somehow have been punished by Woodland Pond for forcing the community into quarantine? So I want to reiterate, the community is not in quarantine. What has changed is that in the health center, we are still in the no visitor mode, and what has changed in independent living is that we, for a few day period of time, stopped group activity and things like the fitness center and the hair salon and the pub and Dedrick's, just to make sure that this didn't turn into something more than what we were fearful of. None of this at any time is done by an employee or a resident or a contractor or a family member or an approved caregiver willfully or in a way that is grossly irresponsible. This virus attacks. This virus, as we are all learning, seems to have little rhyme or reason. You have an incubation period that can be somewhere between 2 days and 14 days. I mean, that's a wild range. You've got people that are positive, including the resident in skilled nursing that has continued to retest positive throughout the course of this last month, that have 0 symptoms. We've got staff members that are being tested weekly, have no known exposure, no suspected exposure to COVID. No one in their life is testing positive for COVID or symptomatic, and they are testing positive for COVID. There is a great amount of guilt that is felt by any person that is told that they've tested positive. It could easily be me. It could be anyone that is not living literally in a bubble. I mean, I live in a household where we are very careful. We do not entertain folks from the outside. We are not engaging in indoor social activity. But my children are attending school 2 days a week. My husband works in law enforcement, so he's interacting with the public. So although we are exceedingly careful, I still have to go to the grocery store once a week. None of us, including these staff members in the last week, or anyone that's come before them, or anyone in the public that contracts COVID would do it willfully, in my opinion. There may be some people that, have had a lapse in judgment and said, let's go try to catch COVID. We've seen some reports of that in parts of the country that are not taking COVID as seriously as in New York. But the messaging that we have for our staff is so incredibly consistent and clear, essentially asking over and over for our staff to consider self-quarantining when they're not at work as much as possible, if not entirely. And the staff are complying. We can't monitor it, and it is in ways empirical evidence, but I would ask that you have patience and understanding for the fact that if a staff member has tested positive, number one, we have no, at this time, knock on wood, we have no evidence or concern of further transmission to another staff or resident. We have a great amount of responsibility that if we find out there is a positive person on this campus, we have to put the campus onto some kind of restrictions. That is our ethical and professional responsibility to all of you. And as hard as that is, and as hard as all of these changes are, we only see one choice, and I only see one choice. The alternative is, instead of, constantly tweaking what's allowed and what's not, and what's open and what's not, we can have a black and white system where it's either all on or it's all off, and do that in 14-day increments, but that would erode the remaining sense of normalcy that anyone is feeling. So we are struggling mightily with how much has to get pivoted, how much gets trimmed back, how much do we sprinkle back in, when do we do that? So it's constant meetings. It's as much information as we can possibly glean when we make our decisions, so that we aren't always saying, okay, new case, we don't know if the person's really sick, we don't know if the person's symptomatic or they're not symptomatic, okay, but we're gonna just close everything down for 2 weeks, period. That does not seem right. That seems like taking a hatchet to what could be easily accomplished with a scalpel. So I wanna just recognize that it's very, very hard on everyone. We understand when we are massaging what's allowed and what's not, but we're doing it in the best interest of trying to give you all some sense of normalcy while also protecting the 600 people at this community. And I invite your questions, I invite your feedback, but I want to just emphasize that I am aware of how challenging this is, and I'm very empathetic to that. So please feel free to vent with me. That's what we are here for, but we are really just trying to not take a hatchet to something that we think can be accomplished with a scalpel, like I said. Just a couple of housekeeping type things before I depart. Again, this will be available on YouTube today. Tomorrow, the Resident Association meeting that is at 3 p.m. will be aired on channel 1340. Only the members of the Residence Council and the incoming members of the Residence Council will be permitted in the PAC, and that it will be one of the minor exceptions to what we are permitting right now. The reason being that this is the annual meeting of the Resident Association, and it is required to be held under New York State Article 46, public health law. And I am concerned that if we delay it or postpone it any further, some uptick in cases could mean that the meeting doesn't happen this year, and that's not permitted under the New York State public health law. So that meeting has to happen tomorrow, and residents will be able to see that on channel 1340. This week, the Council Connection segment on Thursday has changed. The guest speaker will be Dawn Sangri, who is the chair of the Sustainability Committee. So you can look out for that on Thursday. For those that have not been able to collect your newsletter because we close the mailroom until Wednesday. You may get a copy for yourself at Concierge. So you can come to Concierge and get a copy for yourself. Again, the community is not on quarantine, but we are we did cancel congregate activity until Wednesday. I think that's just about everything for today. I will be getting all of this out into a memo momentarily, and we will email that out around. We'll get it printed and distributed to folks this afternoon, and this airing of this broadcast will be available on our YouTube channel later today. I will talk to you all soon, and I'm sending my love and hope for health to all of you. Thank you.